Hey guys, it's Sarah. Okay, so for my presentation, we're going to do female soccer, more specifically age 14, and the three injuries that we're going to be looking at are going to be knee injuries, more specifically the ACL, also ankle sprains, and hamstring strains. So the first one we have is going to be the ACL, which is anterior cruciate ligament tear. This injury is to ligaments are referred to as sprains and have three levels. So grade 1, mild damage, which means it's slightly stretched but still able to keep the knee stable. Grade 2, it's stretched to the point where it becomes loose, known as a partial tear. Or grade 3, a complete tear. The ligament is completely split in two. So ACL mechanism of injury. The ACL is usually torn as a result of a quick deceleration, hyperextension, or rotational injury that usually does not involve contact with another individual. This injury often occurs following a sudden change of direction. A person typically reports feeling a popping sensation in the knee when it hit from the side. Injuries to the ACL are often associated with medial meniscus and medial collateral ligament (MCL) tears. Other mechanisms of injuries are going to be changing direction rapidly, stopping suddenly, slowing down while running, landing from a jump incorrectly, and direct contact or collision, such as a football tackle, collision during soccer, any pretty much contact sports. We're going to see that. The ACL is the ligament that connects the femur to the tibia. So that's going to be the thigh to the shin bone. And the ACL runs diagonally in the middle of the knee and prevents the tibia. The tibia is going to be the knee, the kneecap, from sliding out in front of the femur, as well as provides rational stability to the knee. Assessment for ACL tears or ACL tears or injuries. The doctor will start comparing the injured knee to the non-injured knee, see if there's a difference. X-rays, this is normally just to rule out fractures because it doesn't really show anything besides like bones. And then magnetic resonance imaging, which is the MRI, that shows more of the tissues, bones, which would show that tear. Okay, and then next is going to be the sprained ankle. The sprained ankle is an injury to one or more ligaments in the ankle, usually on the outside of the ankle. Some ankle sprains are much worse than others. The severity of an ankle sprain depends on whether the ligament is stretched, partially torn, or completely torn, as well as on the number of ligaments involved. Ankle sprains are not the same as strains, which affect muscles rather than ligaments. The ligaments in the ankle are anterior talofibular ligament, posterior talofibular ligament, and calcaneofibular ligament. Okay, and then the sprained ankle mechanism of injury is going to be a fall, sudden twist, blow that forces the ankle joint out of its normal position, weak ankles, which is mostly from previous injuries, and then they're normally inversion or eversion injuries. The anatomy ankle sprain can happen to the anterior fibular ligament, posterior talofibular ligament, and calcaneofibular ligament. But it mostly occurs in the anterior talofibular. And then the severity of the ankle sprain depends on whether the ligament is stretched partially torn or completely torn, as well as the number of ligaments involved. This is also going to be assessed by X-rays, which is to rule out breaks also, and the MRI to mostly focus on the ligaments. So strained hamstring. Hamstring injuries are muscle strain injuries. A minor strain is a grade 1 tear, and a complete rupture tear is a grade 3 tear. And the mechanism of injury And the most common is going to be sprinting. This is because hamstrings receive a lot of the force. When the foot hits the ground during a sprint, the hamstring absorbs the impact. Other mechanisms of injury that we look at are going to be jumping, kicking, or highly skilled movements that put a lot of strain on the hamstrings. The hamstring is made up of three in the back of the thigh. It's going to be the biceps femoris, the semitendinosus, and the semimembranosus. And then these are going to be kind of like the same assessment: the physical exam, the x-ray to rule out fractures, and then the MRI to evaluate muscles and tendons. Okay, and that's the slideshow. Thank you for listening.